Canada's struggle to safeguard vulnerable seniors from the worst of the COVID-19 crisis is being put in a harsh new light this morning. We've been reporting for months now how elderly Canadians in nursing homes have faced the worst of the pandemic. By far, the majority of known deaths in this country are linked to those facilities. Well, now a new analysis has come out this morning which shows Canada ranks among the worst in the world for care home deaths. John Northcott has the numbers for us. John?
Yes, good morning, Heather. There's a lot to understand in this, so we're going to try and unpack it. The reasons behind this, some having to do with the number of people in long-term care in this country. The other aspects over organization and actions that could have been taken sooner. But those are the stark numbers. These are coming out from the Canadian Institute of Health Information. That's a Crown corporation using OECD numbers, 16 countries they're comparing us to. There you can see percentage of COVID-19 deaths, 81% of them, of the deaths in this country, coming in long-term care facilities. And then you can see the numbers as they go down to other members of the OECD. So these are the stark numbers. Let's break them down a little further in terms of looking at this. 1 in 5 cases there are in long-term care in this country. That accounts for 81%, again, of the overall deaths. But why is this? Again, it may have to do with overall numbers. Let's look at those overall numbers. The highest proportion of residents of the OECD countries are in this country, over the age of 65. Also, the patients themselves older overall within long-term care. Another aspect they point to this, though, personal support workers per 100 residents, lower than a lot of OECD countries. And also worth noting that of the cases of COVID-19 in this country, 10% of them were long-term care facility workers. So all of that adds up to those stark numbers that are being looked at. Worth noting in this, these are back to May 25th, so we may get a clearer picture not only in the weeks, months, and perhaps even years ahead as these numbers get broken down and we try to understand how this happened and how to prevent it. Heather?
John, at many levels, there are investigations and inquiries going on, particularly in Ontario and Quebec, into what happened within these long-term care facilities. Does this report give any recommendations or ideas for solutions for the system?
It has a few, and we've seen the debate back and forth between various levels of government about who is responsible, not only in the immediate term, but also long-term, and potentially if we redo the healthcare system, who is responsible? The provinces of the federal government. This might play into that. Again, looking at these OECD countries, the numbers show that countries that had a centralized system for long-term care as part of their overall health tended to do better in this. The other aspect to this was, again, that consistency across the system. When the stay-at-home orders went in, when businesses were closed, when the tough measures came down for the rest of society, they argued that the countries that, again, brought those right across the board, including into long-term care home facilities, they had better outcomes, something we didn't do in this country, something we'll be looking at, as you say, Heather, all those studies into how to prevent it in the future.
John Northcott, thank you very much.